Hello, everybody. Welcome back to the Mind Maze. In today's podcast episode, we interviewed nurse acute practitioner Minnie Varghese on her experience as a nurse, how she's able to work with patients with mental health and schizophrenia, and what her experience was like. Hopefully, she was not able to only help us, but help you guys understand a little bit more about mental health, schizophrenia, and her overall journey as a nurse practitioner.
Can you just describe exactly what you do as a nurse practitioner, please?
Yeah, sure. I am an acute care nurse practitioner. Acute care is I'm trained to be working inside the hospital. So that is, for right now, my job is mainly to be working as a house officer. But because I work for a smaller hospital, I attend to the rapid responses. We call it the rapid response team. So my role is as a provider. So that means if a nurse calls with somebody having acute issue in the floor, we answer the call and get there, evaluate the patient, see how critical they are. Then we order the test, what's necessary. For example, if they need some blood test, that needs to be done right away, or some X-ray or EKG, things like that. Depending on the situation, we order the test, diagnostic test. Once the results come, we interpret it. And then we see what's needed for the treatment and we order the treatment. So as a provider, we can do, evaluate the patient, or order the test, interpret the results, and also prescribe the treatment. Mm-hmm. So that's what we do. And then because, as I said, because it's a smaller hospital, we do respond to the RRTs when the admissions come. Are you familiar with when patients take a lot of medicines at home? They get admitted to the hospital. Those medicines, people cannot just pick up and give those medicines. They have to be prescribed by a provider for the hospital, for a nurse to be administering it. So what we do is we look through their list and see what medicines they take, and then look through their lab test and look through their vital signs like blood pressure and all that. Are you familiar with all that? Yeah. So basically the initial evaluation and the test, we decide which medicines need to be continued in the hospital, and we order all those things. That's one part of the job that I do. And if somebody gets discharged, we also see what's needed. If somebody is in the hospital and after 10 days, if they're in the hospital, they cannot walk, they might need a walker, or somebody might need an oxygen. So those things need a prescription from a provider. Mm-hmm. So we do those. So we do a lot of little things for, if you have specific questions about something.
Oh, yeah, we have specific questions. Yeah. We wanted you to just describe exactly what you do. Yeah. Also, this is our third group mate, Arshia. She just joined a little bit late because she had a prior engagement.
Sorry. Yeah. Hi, nice to meet you.
Nice to meet you. So your name is Arshia?
Yeah.
Okay.
Can you just describe if you encounter anything like mental health with patients in your career?
Mental health patients? Yes, that's what, like, on a daily basis. Because my mental health is, a lot of patients, we call it comorbid conditions, right? If somebody comes in with like a drug overdose, so if they took a lot of either drug or illegal substance or anything, they overdose it. When they come and get admitted, sometimes like first you're treating them medically, right? Trying to keep them alive, give them oxygen or put them on a ventilator, all those things happen. But most of our patients, like a high percentage of our patients come with underlying, we call it like dual diagnosis. Mm-hmm. Somebody has depression or somebody has bipolar disorder, but they also have a drug use disorder,
Mm-hmm.
you familiar with opioid use disorders?
Yeah.
Yeah.
Yeah. So people come with dual diagnosis. We have a lot of them.
Okay,
Yeah.
so the next question we want to ask is like, you've had any like personal like stories? Like, do you think there's any like really like important story that you should let us know about a patient with mental health? And how do you like feel about the topic of mental health in general?
Just anything vague. You don't have to give us any like names or anything like that would go against.
Yeah. So are you guys writing or anything regarding a mental health or general in healthcare?
Our campaign focuses on schizophrenia. So we just wanted to see if you've encountered anything with schizophrenia or just mental health in general.
Yeah. So schizophrenia is very common. One of the very common diagnoses in mental health.
Yeah.
And yes, you do get patients with just like anybody else. Mental, people with schizophrenia or other mental illnesses get admitted to the hospital. So mainly what happens is like mental illness can be like if chronic, and then sometimes there can be a bias among, family or friends or healthcare. So it's very important to understand the mental illness well for the people who work in a hospital or with any patients. So we do, most of the people do have a pretty good education or background with the mental health diseases. So, for example, if because I work in a hospital, if somebody comes with chest pain, you cannot, and it can be because they are just thinking they have chest pain. You cannot just ignore saying, oh, they have schizophrenia, so it's not related to heart, right?
Mm-hmm.
So it's part of a provider to just, not just like negate because, they have mental illness, just not take it seriously. So we do treat everybody as equal, We'd still do the EKG to make sure, is it related to the heart, something acute and things like that. We'll still do the blood work. We'll still investigate everything as usual with any other patients. So, we do get a lot of patients. And then we should have a pretty good knowledge about.
Okay, so another question that we had is, I know typically people with mental health disorders sometimes have a difficult time opening up or having it's kind of hard to create a safer environment for them to talk about their struggles, especially in a medicinal scenario. In your past experience with people with mental health disorders, how are you able to create more of a safer environment for them to open up and talk about their feelings?
I am, because I work in an acute care setting, it's not directly, it's not like a counseling place or anything like that. But I work in a setting where a patient is admitted to the hospital, right? So then, we do have a majority single rooms, and we let the patients know that, because patient information is very confidential, right? Let them know your information will be confidential and that's only used for their own treatment, or we communicate only to the other providers or the team only for the benefit of their treatment. For example, if somebody says they are suicidal, they trust us is why they tell us. They feel like killing themselves with, they tell us the plan, and then we can treat them during the acute phase with a sitter at the bedside, with, not, removing objects that could be harmful to them. We have very specific things that we do to prevent that. It's all because, we do provide a very, most patients do trust us.
Mm-hmm.
So that's, I cannot pinpoint a very particular thing because it's like the acute care setting, but we usually introduce ourselves. We say that here, this is our role. So from the beginning, we try to be very open in saying that this is why we are seeing you, because it depends on the stage of their disease also. If somebody is extremely depressed, or some people are in catatonic stage, they're not even moving. They're not going to tell you the whole thing.
Right.
They're not even going to talk to you, right?
Mm-hmm.
So some people are very paranoid. They're suspicious about things. So it's because the provider or nurse or a doctor, because of your background knowledge and understanding and your willingness to listen and all that. And a lot of things comes from experience too. And you were trained to not, look at people without bias. And then that most people, mental illness, people have they are intelligent too, right? So if you understand all that and if you treat them that way, patients are pretty smart. They understand, we can trust this person, and they're pretty open. So they will tell you that, hey, I was depressed about so-and-so. I tried to kill myself. Then I took 30 medicines of so-and-so. And then they tell us is why we can trust them. Some medicines may prolong, we call it QT prolongation. For example, for the EKG, they are high risk to have an arrhythmia and die of a heart problem, right? So if they tell us only, then it's much easier to treat them too, right? Mm. And so we do, you'll be surprised to see how patients do trust a lot of healthcare people.
Okay, we're going to start by asking what you think mental health is. Like, how would you define mental health?
Mental health as a disease, or
just in general, like, what do you think mental health is? And how has stigma around mental health changed? Like, how do you think people before viewed mental health, and how do you think they view it now? Do they take it more seriously, or do they not?
Those are just some of the very difficult questions to answer, because it's I would say depending. It's very broad question, because some people with no exposure to anything related to mental health may not understand it, or just like any disease. For example, somebody has diabetes, high blood pressure, or heart disease, mental illness. Instead of saying mental health, 100% of the people need good mental health, right? So everybody needs mental health. So to me, I think if you're meaning mental illness, or psychiatric illness, that is, if we are talking about that, across the population, everybody cannot have exact same understanding. It's because of their life's exposure, right? So nowadays, kids like you're familiar with these things, you're researching on it. So you may not see a person, if somebody tells you they are depressed, you won't go to another friend and say, oh, that person is crazy, Yeah. So you won't take it lightly. You probably understand that is the chemical changes in a person's brain makes them to be depressed, right? You won't say, oh, just be happy, It may not be that simple, right? Mm-hmm. So across the population, if you see, it's hard to define if it has changed or not. But in medical community, definitely it has changed, and people have a better understanding. But because people with mental illness, treatment can be very challenging on the caregivers, providers, because it consumes time. Because we can be very busy with the work, right?
Yeah.
So even though it might be ideal to talk to somebody for an hour, that's not feasible or practical in regular day-to-day practices, right? Mm-hmm. So I would say generally there's a good understanding, but also people suppose, for example, if somebody is non-compliant with their psychiatric medications, for in your case, a schizophrenic patient is not willing to take their medicine. So if you ask the providers to have compassion on that person, that's not very easy for every provider, right?
Right.
So yeah, so it's hard to. That's a very hard question to answer in one or two sentences. But I think there's a lot of awareness coming. But depending on the federal funding and things like that, if a hospital has, like, for example, 30 patients admitted, and there's like one counselor there to solve all these problems that they come up with, or so that may not be enough. So the federal funding is important, understanding on the administrative level that this is important. If you think about it, if you want to keep your community safe, in your school, you go to a school and you hear a lot of shooting after every event, and somebody comes up and makes like big statements on TV. But if they do nothing about counseling the students and catching early signs of people's depression or anger, anxiety, and things like that, it's not of any use, right? So if somebody knows that, I don't know the count, like if 10% of this grade level kids can get depressed, if people know it already, why not start the treatment, prevention early, right?
Right.
So there are a lot of things we could do. System might like difficult to treat patients, non-compliant patients, things like that, right?
Yeah. Exactly.
But general understanding and is there. Okay.
Okay. Yeah. So, another question we have for you is, like, over your time working working with patients, who may have things such as like mental health illnesses or disorders, like, what have you been able to like learn about yourself, or like what lessons or like things such as empathy were you able to take away from working with patients who do have things such as mental health disorders?
Definitely, I see if I consider myself, like, if I compare myself with other family or friends who are not medical professionals, I think I consider, I feel like I'm more fortunate to see what goes on and more have like a better understanding of what happens, and you can be, so if you see how I see myself, what was the question again?
Just like, what lessons were you able to learn throughout working with mental health patients? Like, were you able to like how were you able to learn about empathy and compassion through working with mental health patients?
Yeah. So, in one word, somebody supposed to think that, compassion is like, some people are compassionate, some are not. That's how, like, a general understanding for people think. But what I have understood is that compassion and empathy, you have to it's a learned behavior, right?
Yeah.
So if Nabiha goes and sees a patient, you can say that, my God, this person is talking too much, and then let me go, I have homework to do. That can be like an immediate normal response. But if you go to a patient and say that, hey, this person has been struggling with schizophrenia, he might be talking more, or, they might be suspicious about who I'm coming with. Let me not look like I'm rushing to get out of this room or talking in the room, right? So when you that's a learned behavior. You go see a patient, before that you try to get the information, you try to build trust, and you gradually, each time you build yourself up to have that, instead of thinking that, I'm always like very abrupt. Some people say, I don't have patience for that, So instead of saying that, it's something that you you build because you have the knowledge and experience, and you build. As you gain more knowledge, you get better. Have you heard that, there's a saying where this like rice, when the paddy fields, the rice grows, the more rice it has, like the head bends. Mm-hmm. Have you heard like that? The head of the plant, like it bends because of how heavy it is inside the grain.
Yeah.
I haven't heard of that personally, but I can see where
then I guess it's a bad example.
Due to Wi-Fi issues, unfortunately, our interview was cut short on recording, but we had a great interview and we were able to learn so much about schizophrenia and how it's like dealing with things like schizophrenia and mental health from the healthcare field. Thank you so much for your time and listening. Have a great day, and we hope to see you on the next episode.